All right, as people are starting to come into the room, I think we'll go ahead and get started with some introductions. So thank you so much for being here this morning. My name is Mark Clements. I am the Chief Medical Officer at Glooko, and I'm a professor of pediatrics in Kansas City, Missouri. It's my distinct pleasure this morning to have with me two outstanding panelists who are leaders, obviously, in this field. So the first I'd like to introduce is Gary Scheiner. Gary, thank you for being here this morning. Gary's the Clinical Director of Integrated Diabetes Services, practice located just outside of Philadelphia, and specializing in intensive insulin therapy and advanced technology education for children and adults with diabetes. He's been a certified diabetes educator since the mid-1990s, has had type 1 diabetes for a decade before that. He was named the 2014 Diabetes Educator of the Year by the American Association of Diabetes Educators, the precursor to today's name for the organization. And he's written 7 books, including the best-selling book, Think Like a Pancreas, A Practical Guide to Managing Diabetes with Insulin. Gary lectures nationally and internationally for people with diabetes as well as professionals in healthcare. And he's served on the faculty of Children with Diabetes, the Board of Directors for JDRF, and volunteers with a number of organizations, including the American Diabetes Association, Diabetes Sisters, and Set-A-Bae Diabetes Camps. It's also my distinct pleasure to introduce Jean Arnold. Jean, thanks for being here this morning. Jean is a registered dietitian and nutritionist and certified diabetes care and education specialist at the Johns Hopkins School of Medicine, where he directs an outstanding program. He splits his time between direct patient care and as the program manager for the Johns Hopkins Diabetes Self-Management Training Program. He oversees a team of 10 diabetes care and education specialists who practice in the greater Baltimore area. And his main areas of interest include diabetes technology, hypoglycemia fear, health behavior change, and telehealth, all topics near and dear to my heart. So if we can, let's just give them a warm welcome. Thanks for being here this morning. So we thought we'd keep this a little bit casual this morning, right? Everybody's just arrived in Baltimore. We're just getting our first or second or third cups of coffee in us. And we're just going to have a little discussion and keep it light. So the question I have for the two of you first is if you can just describe your clinical practice and how Glooko fits into what must be a complex ecosystem within that practice.
Thanks, Gary. For my practice, we kind of have 2 prongs, right? So we have the clinical piece. We have diabetes centers throughout the region. We have community locations at physicians' offices. Patients come in, right, with their glucose meters. We download them. Believe it or not, before we expanded our program, we only had the Glooko transmitter at our diabetes centers. What we've done is we've kind of developed like mobile diabetes education stations, right, where the educator will travel around to different clinics. They'll bring their Glooko transmitter. They'll bring their bag with all their, teaching supplies. So we're really, with Glooko, we're able to really take this this data, right, that PCPs don't have access to, and really open that up in the practice and deliver diabetes care and education the way it's supposed to be delivered, right? So I'm sure everybody here has been practicing before, sometimes without data. Very difficult, right, to help a patient without any data. So that's kind of like the more obvious use case. We have another use case. Johns Hopkins Healthcare has developed a diabetes self-management platform. It's a behavior change platform. It's called Blossom. This is kind of a separate arm from the clinical piece where folks enroll in Blossom. They work with employers, different health plans, and they can use the Glooko app. They can upload their readings to Glooko, which then transfer into the Blossom portal. And this helps health coaches who work for Blossom interact with patients with relevant data, right, and not really providing them generic, educational pieces of info, but helping coach participants, based on their readings, right? So we have the patient comes to us, download the information, and then we have the patient uploading mobily, and this ranges from clinical, right, care to health coaching. So there's a really wide use case, I would say, for Johns Hopkins with Glooko.
Perfect, thanks. Go ahead, Gary.
9 a.m., I figure half the people here are jet lagged and half are dealing with traffic getting here. So no one wants to think about data at 9 o'clock in the morning, am I right? I think it's important to consider what's going to make our lives easier, what's going to make it better and easier for us to do our jobs, serve our clients more effectively, and place less of a drain on us. My practice is a little unique. It's a private practice, and it's about 80% virtual, 20% in person. And we serve people nationwide, even overseas. We've got clients on 6 continents at this point. And being able to access patient data is so important to be able to serve them well. We deal primarily with patients on intensive insulin therapy. But we do have our share of patients with type 2 as well who aren't using any meds or insulin at all. And in order to be able to counsel them, we need information. It's not enough to just look at glucose data. We need context. I always describe it this way. I'm sure, has everyone here seen the movie The Godfather? Or you know what the movie is about? If you only saw a still shot of Vito Corleone playing with his grandson in the garden, what would you think the movie's about? It's like On Golden Pond, but you watch the movie and you get the context. You understand he's the head of a mafia family and he's in charge of murdering people and a lot of illegal activity. Not that this is involving murder and illegal activity, but you get the idea. Context is valuable, and being able to understand not just what's happening but why. As clinicians, we want to get to the bottom of the problem and not just find the easy answer. It's not always the right answer. And that's why I appreciate the Glooko program. It allows me to put context behind the data and not just see the glucose values. It does a great job of displaying glucose data, but it also lets me see the food information, the insulin information, the physical activities that took place. The app allows people to do that. A small investment can go a long way. We teach the patients how to use the app and how to download their own stuff, how to use and interact with the app. It saves a lot of time. They have very good instructions online, but we went the step, making our own instructions step by step of how to use it so that when a patient comes in or has their appointment, we've already got the data there. We got the information that we need. So that's something I really like about it.
Yeah, perfect, thank you. And I'm going to call that out as the best use of the movie The Godfather to advance diabetes education. So I think that's a first. What are some of the biggest challenges that diabetes educators and diabetes coaches face today, you think, particularly in an era, during and post-pandemic, right? We're sort of in and beyond some of the worst of it that happened initially, which has driven us toward a lot of more remote care. Can you just talk about some of the challenges that you face and you see some of your colleagues facing?
You want me to take it? Sure. This might be a little obvious, but our practices are mostly in Baltimore and the surrounding regions. We have folks, of all different educational backgrounds, right, different socioeconomic status. The number one challenge is actually getting the data, right? So that's, like I said in my prior answer, that's a huge reason why we're bringing these transmitters to the patient, right, to where they get care. For so long in primary care, diabetes has been managed with A1Cs. And I think we all know that just because your A1C is in range, it doesn't mean that you're not having hypoglycemia, right? So I would say the biggest challenge by far is actually getting that data and being able to, obtain that from all different types of folks.
Time has always been one of our most precious commodities, and having enough time to spend with patients is sometimes challenging. We have to spend a chunk of every appointment, accessing their information, it really takes away from being able to provide insight and teaching to patients. And it's just very helpful being able to have the data even before the patient comes in for their appointments. And even before COVID, virtual care has been on the grow. We're able to provide good virtual care now, not just during scheduled appointments, but between scheduled meetings. Granted, you have to get reimbursed for that kind of time, but in many cases now you can. If you package your services, you can get reimbursed for that time of evaluating patient data and offering them some insight and some useful and helpful adjustments to it. So just having universal access to data in an efficient way, it saves us time. Accurate information is also very valuable. I still remember patients bringing in those log books with blood smears and ketchup stains. You can never really trust completely the info. I always knew if the log book or the log sheet was clean, they made it up. But eventually they catch on. They'll start wrinkling them up and smearing them with things, make them look more realistic. When you download something, and if they've taken the time to enter things into an app, usually it's pretty reliable. So that's also getting accurate, reliable information is very beneficial.
It's interesting that you talk about trusting the information on the old logbook sheets. I think with current technologies, we continue to have little clues that we follow. So if I see a child or a teenager in clinic and we see that, all of the insulin doses or all of the carb counts or even all of the glucoses are multiples of 5, right? Then we know that maybe we don't have an honest broker here, that we're entering a lot of things manually or even making it up. So one of the questions I have for the two of you is the data are so central to what we do in diabetes care and education, and I think we have a real problem with interoperability of data, right? So Gary, you mentioned how important it is as a time-saving solution if you can get the data and the insights in a way that reduce the cognitive burden, I suppose, for educators and clinicians to provide care. And at Glooko, I have really driven home the point that I don't think our product is a data integration system. I think our product is the gift of time to clinicians and educators so that we can really have conversations about the things that matter most, because if we spend half the time getting the data, right, there's less time to have those conversations. So
it's also a gift of desk space.
Yeah.
I had a photograph years ago of my desk, and half of it was covered with cables, and half of the cables had multiple adapters on them. I mean, most of you who've been in this for a while can recall that. And it's challenging when you have 20 different devices. You got CGMs and pumps and meters and step counters and all kinds of things, and trying to integrate all of that, getting the data into the system, it used to be very onerous. And I called Glooko a midware program because it sort of serves as a bridge for everything that's out there, and being able to universally collect it without all of these cables and adapters to be able to fit things together. So I thank Glooko for giving me desk space again. It's nice to have. It's for things like food and snacks.
So where do you still see pain points in interoperability? Whether we're talking about Glooko or the field as a whole, what do we need to improve upon?
Well, some of this, I think, is on the companies and the manufacturers themselves when the data is not made available. There are a handful of companies that still do that. I'm not going to name them here, but when you're out in the exhibit hall and you're with a company, ask them if their data is accessible, if it's open access data, or if they privatize it. If they privatize their data, it's not going to be readily available. It's going to be difficult to access unless you use their program. Put some pressure on them. We have the ability to pressure these companies, and get them to change that sort of thing. So encourage you to do that.
Yeah, no, Gary, I think that's a great point. We have a lot of folks who participate in, closed ecosystem devices, and we can get the data, but even the way that it's displayed when you get it, right, is not the same as you're used to looking at with Glooko. I mean, Glooko has such a wide presence that the clinician is used to looking at the data in a certain way, right? And when that gets changed up, it becomes much more difficult, right, to help the patient, particularly when all the glucose values are listed in a straight vertical line. I'm sure people get that. And it's much more difficult to help folks.
I'm going to use another movie reference, and this is Dirty Harry Callahan, but one of my favorite lines he used was, "A man's got to know his limitations." A company that designs and builds glucose meters or sensors or pumps or smart pens, that's their thing, and they're good at that. They're not specialists at software and report data generation and insight integration. It's not their thing. I like to leave that to a company like Glooko, where that's the sole thing they do, and they do it extremely well. So a company that designs a pump or a meter and has their own software to go with it, I can guarantee you it's going to be lacking compared to a program like Glooko. So again, even though they may say, yeah, well, we have software that'll generate this for you, well, I would take that with a grain of salt. Just ask them, well, is that your specialty, building software so that we can analyze this sort of thing? It's not. It really isn't.
Great. All right, so I'm going to throw a new question at the two of you. Context is important. We established that with the Godfather. And I think that the value of data coming from all of our diabetes self-management devices is made more valuable if we have the context of behavior, if we have the context of coping, basically things that can only be measured as patient-reported outcomes, if you will. Talk to me about the context variables or the context information that you find the most valuable, and about the current state of being able to collect that kind of information systematically in your clinics.
Sure. So I would say for Glooko and other platforms, right, similar answer. When somebody is documenting that they exercised or that they're stressed or what food they ate, right, it's incredibly important for the clinician to be able to see that, so that can help guide the conversation, right? When you only have 30 minutes with a patient or even less, right, the patient will come to you telling a story, or sometimes not, right? But they might not remember to tell you everything in a certain order or in a certain way. And, being able to see things that they documented, weeks ago can help you understand kind of like what they've been going through as they try to tell you, and then it allows the clinician to jog the patient's memory as well, right, to get a more complete picture. That's my answer. Yeah.
Thank you.
The number of variables that affect somebody's glucose level, we would be here all morning if we went through and made a list of those. I think the humidity here affects my glucose level. The mood affects the glucose level, your sleep level, your restfulness, your hydration level. There is so much. It's not reasonable to capture everything, but I mean, as clinicians, we're all keyed into these things. And we might say to somebody, were you stressed here? Or when did you last exercise? It has an effect. One area I think all of the companies could really do a better job with, as far as the reporting goes, is in the physical activities space. Just being able to mark that you've exercised is one thing, but just having some more detail about what you did, what the nature of it was. Because I work with both children and adults, and there's such a difference between a competitive activity and just a workout to keep yourself in shape. The glucose responses are completely different. Between anaerobic and aerobic activity, the responses are very different. And just for each individual, the responses can vary based on the situation. So the physical activity part is one where just having as much detail as possible is really helpful. Some systems, and Glooko does give a person the ability to customize the entries, But I'd like to see that happen more often, because I find that to be one of the variables that's often overlooked and not given as much attention as it should be.
Yeah. Thank you. I will point out that you know, the Glooko mobile app does allow individuals to share objective data from their wearable fitness activity trackers. There are a number of trackers integrated. So I think for any centers really thinking about implementing what Gary alluded to, you know, just getting more granular physical activity data as context, that's possible to do today. So last question before we close. How do you, so one of the things we're thinking a lot about at Glooko is how one identifies the most at-risk individuals in a population with the idea that we don't want to deliver one-size-fits-all care, but that we want to really tailor the level of care and the intensity of that care to the individual. How do you currently handle the identification of individuals who might need a little more, you know, from your practice? And I say that, you know, recognizing that it's really not just about education, but also about education and coaching on behavior, right? Habit formation is really challenging, and it's 90% of diabetes self-management.
Sure. So I'll speak about Blossom first. So the way that Blossom is set up, if a participant is logging their glucose information or is using the app and they're having the Bluetooth uploader, the coaches actually get a notification if their glucose is out of range. So if it's anywhere outside of that 70 to 180, they're getting a notification. And we have a protocol in place that, you know, if a certain number of readings, and depending on how out of range they are, they will get a notification from the app directly. They will get a call from the coach eventually with some instruction to the participant on like what to do, you know, to contact their provider, et cetera, to try to convey to folks that, you know, these numbers are either dangerous or very high and that they might not otherwise know that. For our clinical piece, I will say that right now, Johns Hopkins is not using a population approach with Glooko. You know, as in like I try to identify folks who have numbers that are out of range. This is something that we're looking into, and I think this is really the next step for us, right? Having more proactive outreach, you know, utilizing RPM, these sorts of things. So I think Glooko is going to be a huge part of that moving forward for us. I'm excited for it. We're not doing it yet.
Yeah, thank you.
So Mark, you used the word granular before, and that I think it's a very valuable term. What we try to do when looking at data is start with the big picture view and try to identify if somebody is having issues and then become more granular. So the whole, you know, the Godfather analogy, that comes into place when issues are present. If there's no issues, we don't have to do that. We can focus our time on other things. My favorite thing about the Glooko program is something called a modal day report, and not every software package has it. Even some of the other big midware programs don't all have this. From a CGM standpoint, it's what's referred to as the spaghetti graph. I mean, it's a scary looking graph. You have multiple days of data superimposed on top of each other, and you can customize the time frame you're looking at. But if you look at the last week or 2 weeks, the spaghetti graph to me shows you a beautiful picture, a beautiful big picture of what's happening. I think it's much more valuable than the AGP, the ambulatory glucose profile, simply because there are going to be outliers, and the AGP doesn't capture those, but you can see those on an overlay report. But you can also see what the usual daily pattern is. Yeah, and then you can pick out the ones that are out of range and get more granular about those. But that report to me is extremely valuable, and some of the summary statistics that go with it, extremely valuable. And that's a great way to track a patient's progress and give them a pat on the back. If you tell them, wow, you know, you went from 52% in range and now you're at 61%. That's fantastic. It's like going up a whole grade level in school. And they love that. You always get a big smile when they see that. And they think, well, I'm not doing great, but you know, you went up 9% in your time in range. That's terrific. So I think that's great. And, once you do identify when there are patterns and things that are a bit off, then the granularity comes in. That's when you can dig into the details when necessary and try to find the reasons behind the issues that are taking place and find practical solutions. I find if they just go back to their primary doc, and even in some cases back to their endocrinologist, they're always saying, all right, well, up this medication, lower this dose, and that's not always the answer. Oftentimes, these are lifestyle and behavior oriented, related to food choices, activities, things like that. And having that background, that contextual information lets us be better problem solvers.
Yeah, that's great. So we'll probably end on that note. I just want to add that, I think we all have these decision-making heuristics where we start with the top-level view, like the 10,000-foot view, I call it, and then naturally we try to drill down. We may not do that systematically. We may not have standard work for that in our clinics, and I think that standard work is really important. Doing it the same way every time really prevents errors and prevents omissions in care. And then the last thing I want people to be aware of is that Glooko does have a population health platform. And so if you do want to identify that list of individuals who've had a drop in their time in range or are having a lot of a high percent below target, et cetera, that's possible to do. You can run a list weekly, monthly, whatever you want to do. So certainly see us at the booth if you have questions about those capabilities. I want to thank our two panelists. Thank you so much for joining us this morning. Thank you all for being here this morning. Grab another cup of coffee. It'll be a great day. Thank you.